This week, we have seen the National Health Service at its best, tackling the dreadful aftermath of the Manchester bombing. Politicians and voters from every party heap praise on the ambulance workers, paramedics, doctors and nurses for their unstinting response to the tragedy. But with the election campaign now resumed, the growing demands on the NHS of an ageing population and how to pay for it, once again, a political football. Now, while all sides broadly agree the NHS should remain free to users, there's a major divide over whether using the private sector to run hospitals or GP surgeries or to provide staff or for services like cleaning, catering or physiotherapy helps or undermines Britain's healthcare system. Is the private sector helping the NHS? Neil Dickson, NHS Confederation. It's like sacrilege to a lot of people. Any private involvement seems to decry and abuse the very principle of something that we hold so dear.
Well, the bond between the British people and the NHS is as strong as ever, as the events of the last few days have shown. And what NHS staff did over the last few days, I think, has genuinely moved people, both how efficiently and compassionately they responded. But the broad issue about why people are so fond of the NHS is its founding principle, which is free at the point of delivery.
Yeah.
So if we can put that aside, and everybody has agreed that that is the right thing, and I think that is the view overwhelmingly of the British people, there is then a discussion about, do you have to have everything publicly provided as part of that deal? And the answer is that since the NHS was founded in 1948, from GPs who've been independent contractors to the NHS since that start point, through all the years that we've been, the NHS has used the independent sector. It uses the charitable sector very significantly, for example, in hospice care and so on. And if you ask people who use those services, do you mind who actually runs this service, as long as it is good care and good value for money, both of those are very important, overwhelmingly they don't mind whether it is a publicly provided or a privately provided service.
People are worried about the direction of travel when they see what has happened to other industries over the years, the utilities, telecom, railways. There are those people who think that, strong arguments on both sides, but there are those people who think it's been a downhill trend, and they're worried about that we might move to some kind of an American system, which most people would dread.
Well, I think most people would dread the American system, and the key point there is that care is not free at the point of delivery, so people can find themselves losing all their income if they have any income. Of course, there is a system in America for the very poor, but it's regarded as a second-rate service. Now, the founding principles of the NHS, established from 48, is that we should all be treated the same and that it should be free at the point of delivery. I don't see that being undermined by the fact that you happen to use an independent sector hospital to do hip replacement.
There's an article in the Telegraph this morning saying at one GP surgery, obviously you can wait a long time, perhaps a few weeks to see the GP, but you can, in the same surgery, there's a private practitioner or a range of them, and you can see them now for 39 quid. People are worried that it's kind of creeping. But if it works, Owen Jones, if it provides some flexibility to the NHS, to what some people say is a great sort of immobile monolith, isn't it a good thing?
No, the NHS should be run on the basis of patients' needs, not profit for profiteering companies. And if you look...
But if it worked...
But it doesn't, and I'll explain why. Look, we have an overwhelming... the direction of travel has been privatisation. But because we've had this public model, as one study, the Commonwealth Fund showed just in 2014, we come top of the health systems that they analysed, the US system, of course, at the bottom. What has privatisation meant in practice of our health services? It means it's become more inefficient, because what you need is extra layers of bureaucracy and management to deal with all the complex private contracts. The amount we spend on management, on bureaucracy, since we started this, has gone from 5% to 15%. It's double that in America, where they have that system. That's one thing. Second thing, obviously their interest is making money. It's making profit, these companies. So how do they do it?
That's people making a living, isn't it?
Well, yeah, but should they do it with a health service, a basic service that we depend on to save lives and look after our health? Now, what do they do to make money? They have to cut costs. And they cut costs by cutting salaries and undermining terms and conditions of the courageous workers that you talked about.
I'll come back to you, because there's a couple of points in there, and it's worthwhile taking them, for Neil to take them one at a time. We'll bring Clive in as well. Bureaucracy.
Well,
There's far too much bureaucracy involved in the private sector.
The answer is it's not he's not actually talking about the bureaucracy of the private sector.
I'm talking about the public sector that oversee the private contract.
To have any form of contracting system, then obviously you do need to have people who are doing contracts and all the rest of it. You also, of course, have to have people held to account at local level for how well they're doing. And that would apply to both public sector organisations or private sector organisations, or indeed if you had charities who were running these particular services. So something that at local level holds people to account for how well they're doing, I think is a cost you have to pay. But actually, our administrative costs as a healthcare system are amongst the lowest of the world. It's one of the reasons why the Commonwealth study found it did so well. I'm not saying public sector bad, private sector good, and neither should you say it the other way around. There are absolutely first-class private sector services that are serving the NHS at this moment, and the idea that all their staff are utterly obsessed about profits, that they're providing bad care, that they're trying to screw out the cost all the time, there isn't evidence to support that. Indeed, if you look at hip replacements, 8 out of the top 10 providers are actually private sector. There are also fabulous public sector providers. Let's not get hung up on
Here's
who
the question,
runs it.
Clive Peedell. Clive Peedell, I'm sorry, Clive. Has the private sector, by the means of competition and concentrating the mind, improved in any way the efficiency of the public sector NHS?
Well, unfortunately not. We've got a single-payer system, so we've got a fixed pot of money. And the whole argument about bringing the private sector in, the only way it can be more efficient is to have a market system. That's the whole ideology of the way the private sector works. But markets don't work well in healthcare. We've heard about all the transaction costs, and it's huge. It's multiple billions of pounds per year. The other big problem is you actually, in order to have choice, you need to have excess capacity in the system. So you've got all these extra independent sector treatment centres that are poaching NHS staff away from NHS hospitals. We've already got a shortage of staff. We've got a £3 billion agency bill. That's just making it worse. And with Brexit coming up, along with our EU workers leaving, that is a huge problem. So it destabilises local health economies. And because money follows the patient, actually those NHS hospitals that are already, we've seen, are massively in debt. 50% of NHS trusts are in the red. They're losing income, and you lose income, you then lose staff. And I call it dominoes then departments start to close, and it's an utter disaster.
Andrews, an utter disaster.
One of the biggest tricks that NHS campaigners have ever pulled over the British people's eyes is this idea that the only two systems in the world are the American system and the NHS. This idea that market access to healthcare doesn't work around the world is completely debunked. The US is the only developed country in the world that does not offer universal access to healthcare. But contrary to being the envy of the world, no other developed country has adopted the NHS. Look at Switzerland, look at Germany, Belgium, the Netherlands, Australia, New Zealand,
We have the
Singapore.
gold standard in this country.
You don't. You tend to rank in the bottom third on par with the Czech Republic and Slovenia. Owen mentioned the Commonwealth Fund report. I loved the Guardian's sum-up of the Commonwealth Fund. The Commonwealth Fund looks particularly at inputs. How good is a system at ticking boxes? Now, that's a legitimate way to measure a healthcare system. It doesn't look at outcomes. On the one question where the Commonwealth Fund study looked at outcomes, the UK ranks 10th out of 11. And the Guardian's report of it was brilliant. It said, without any irony, that the only black mark against the NHS, according to the Commonwealth Fund, was its poor record on keeping people alive. This is not a system that is built for 2017, and we get frightened by the word of privatisation, but to look at countries that we wouldn't consider to have private systems. Look at Switzerland, look at Germany, where you have universal access to healthcare.
So how much further would you like to go down this road?
I'm a huge fan of the social health insurance systems that are just proliferated throughout Europe. Switzerland,
How does that work?
Germany.
Just tell people.
Basically, the government makes sure that everyone has universal access to health care. All of your bills and funds are paid for. It might be through a voucher system, it might be through charities, but the government funds completely your access to health care. But the private sector runs it, so it tends to be more efficient, and it tends to get much better outcomes. Thousands upon thousands of lives are saved every year in the Netherlands, in Germany, in Belgium, especially when it comes to the most serious things like cancer conditions and heart attacks. This is where we need to be focusing.
Owen Jones.
Just on cancer, for example, this always comes up. They always use this as a stick to beat the NHS, but they're not comparing like and like. For example, in the US, for example, which is often...
Again, the US.
Well, no, but that's the
US.
comparison often... Well, OK, other countries. What we do is we have a 5-year survival rate. That's how we define how many people survive cancer. In other countries, they look at, for example, pre-cancers, which don't even turn out to be cancers. If you lump them in to those statistics, then it looks like you've got a better cancer survival rate. So it's not comparing like on like.
Well, no, a lot of these comparisons are comparing like for like. When the IEA did its own research, it just simply looked at the systems and the way that these things are processed and how efficient they are and how quickly you can get things like access to surgery to remove tumors. And I just want to point out again, all we hear from the NHS campaigners is USA, USA. It's fear-mongering. We need to talk about the rest of Europe where they're doing better.
Clive, you're an oncologist. You're an oncologist, right?
I wouldn't argue, actually, as an oncologist, that cancer outcomes are not better in some of the countries that you've mentioned. But Germany, France, they spend an extra 2% GDP per year, and that's cumulative. So if you look back at the One List review, he estimated that the NHS was underfunded compared to the EU average by 267 billion over a 25-year period. Now, we just about caught up to that when Labour increased the spending, and then the financial crash happened, so we've fallen back down below again. So you can compare all those social insurance models all you like, but they are more expensive. We've got a single-payer system. The public wants a single-payer system. Therefore, you cannot have a private sector delivering NHS care. By all means, a separate private sector to take the pressure off the NHS, but please, not a private sector competing against the NHS. It's a disaster in a single-payer system.
Niall first.
So the comparing of different healthcare systems is very complex, but the answer is the NHS has been underfunded. So it isn't fair to compare it in that sense. But again, I go to this thing of if it's private, it's good, if it's public, it's bad. There is no evidence to support either of those contentions. The answer is if something is properly funded and it has good leadership and the right values within that, and the idea that all private sector healthcare organisations don't have those things is nonsense. So the answer is we have a very good healthcare system. It would be a lot better if it was better funded, and it needs that more funding.
So if it were to be better funded and have enough money, would private sector involvement be in any way, at any time, at any way, shape or form necessary?
Yes, and I think you could demonstrate that looking at the 2000s, when the big issue was getting access. And it is true that the independent treatment centres absolutely both shook up the NHS and made it more competitive, and got people care that they would not have got otherwise.
But if they were expensive in the NHS, we wouldn't have needed them.
I'll be with you soon.
So I think it's just a really dangerous road to go down. So I was actually in a private hospital when I was younger that was funded by the NHS. And they spent thousands and thousands of pounds every week keeping me in there. And what was the motivation for this hospital to get me better? In fact, we had to get the MP involved because my father felt that they were just drugging me to keep me in the hospital. The moment the MP was involved and they said, you're not getting a good care plan, funnily enough, 6 weeks later I was released. So I think privatisation is massively risky.
But there's good practice. I'm sure there's bad practice everywhere. White shirt, hello.
Private organisation has an efficiency role to play in NHS. However, NHS assistance is a quasi-public good, which means, in principle, private organisation coexist with public bodies such as NHS. To allow private organisations to run the NHS will bring about trickle-down economics. What it will do, it will drip down and just make the mess of the whole thing. Specifically, it will allow the roses that grew from the concrete with damaged petals. It will allow them to wither away. We don't want that in our NHS. Carol Proper and Simon Burgess from Centre of Market and Public Organisation did actually look at the link between competition and improvement in healthcare. What they found was a negative relationship between competition and quality of healthcare.
Who thinks there is a positive relationship between competition and positive healthcare? Anyone in the audience? Because I know you do, Kate. I'm just wondering if anyone in the audience, I know you're kind of on the other side of it, because I did see some people nodding when you were making your point, Kate. Kevin, do you want to come in here? I know you have strong thoughts about this.
I do have strong thoughts about it. I think I'm pretty much in Owen's camp on this. I think that the NHS needs to be publicly owned, publicly delivered. If you follow the money trail, as you have to if you talk about privatisation, you end up saying, where does the profit go, which is outside the NHS? Who gets the money? The shareholders. We're all shareholders in the NHS, and it should stay within the NHS. I think the other thing is that it's a unique organisation, the NHS. Its mission is unique. Its mission is purely excellent service delivery, excellent clinical outcomes. There isn't excellent clinical outcomes, excellent service delivery, and make a profit. So the important thing is service delivery. A private company, inevitably, within the contract, has to build in a profit. So service delivery plus profit, it measures itself on the money it makes. And we saw in some of the other government privatisation initiatives, say, for instance, welfare to work, telecoms, Royal Mail, other things that have been privatised, we've seen the cherry picking, where private organisations will say, happy to have this contract because it's measurable, it's profitable, and we'll have that. This bit over there, I'm not too keen on delivering post in the
that point, Kate Andrews, isn't that inevitable, the Kevin point there, that some treatments are more profitable than others?
We already have a terrible system of rationing on the NHS. I mean, the NHS rations more than almost any other country throughout Europe. If you want to talk about getting access to treatment, it's not the private sector which is holding it back, it's the NHS compared to any other country.
The NHS is not rationing treatment. The government is rationing money for the NHS. That's where the rationing comes from.
I completely take your point about the goal of the NHS to be to provide immaculate health care. What happens when that goal isn't being achieved? The NHS is in a state of perpetual crisis. And I think that people across the country are waking up to the idea that people in France and Germany and Switzerland are getting better treatment, and it doesn't seem like a scary privatized system. And can I quickly just say that there actually might be an area of compromise here? I mean, I'm very much open to the idea of putting 1% or 2% more GDP towards healthcare in this country. But that comes secondary to the fact that the system itself is failing. It comes in the bottom third in these areas, and it needs reform.
In a second, Owen, I want to just get Niall, who's got the finances swirling through his being on this. So I will be with you, Owen, on this political football. And I know you know the finances of the NHS, inside, out, and back and down, and north and west and south and east. Will there ever be enough money for our ever-expanding needs in our ever-ageing society?
Yes, I believe that that is possible to do, and I believe it is possible to do it with a publicly funded system. But I do think there has to be a wake-up call among all the political parties.
Where do you get the money from?
Well, that is a matter for society to decide. But if you believe in a free at the point of delivery service, essentially it has to come in some way from taxation.
All our taxes? Not just those lucky enough to be at the top? All our taxes?
Well, that's up to government to decide.
No, it's up to you, Niall.
No, it isn't up to me, Nicky. Thankfully, it isn't up to me. Can I just finish? The answer is the system is underfunded at the moment. We are going to face, over the next 20 years, a doubling in the number of elderly people over 85. That means that the demand that's going to hit the system, however it is organised, is going to be very substantial, and it will involve changing the way that we pay organisations and changing the way we organise services. And that, in a way, is the bigger question, which we're not really dealing with.
We'll hear from Owen and Clive as well. Owen.
Well, look, I mean, given the NHS has gone through the longest squeezing in its funding since it was founded, given we spend less on the NHS than almost any industrialised country, and given the cuts to social care as well, the outcomes are frankly miraculous. But I think, above all else, the issue here is dogma. The people who don't like the NHS don't like it because it is an embarrassment to an ideology which we've seen dominating this society over the last generation.
Who doesn't like the NHS?
Which you put profit, people who want to privatise it. Because what the NHS does is put people's needs before profit in a society where increasingly it's the other way around.